I'm now pleased to introduce Dr. Melvin Belzer. For those of you new to our series, Dr. Belzer, PhD, has taught mindfulness meditation for 20 years. He is an adjunct associate professor in the UCLA Department of Psychiatry and Biobehavioral Sciences. He teaches an undergraduate course at UCLA and mindfulness in many different venues. Dr. Belzer, you can take it away.
Thank you. Thank you. It's been an honor to be part of these sessions. This is the sixth time for this year, and I've thoroughly enjoyed it. Let me just put in the chat some information about the UCLA Mindful Awareness Research Center in case what we do during the next 10 minutes sparks your interest. Then there is a free app called UCLA Mindful with guided meditations by my colleague, Diana Winston. And these also are available on our website. And also feel free to contact me directly. I really don't have anything better to do than respond to emails about mindfulness and meditation. And I mean that seriously. So I welcome inquiries, questions, and so forth. So what we'll do in these 10 minutes is I'll talk for a minute or two about what mindfulness is and how we practice it in a meditation. We will do a meditation together. Of course, if you don't want to participate, that's fine. It's a very personal activity and so forth. But in this day and age, mindfulness is becoming mainstream rather quickly, and most people I find welcome the opportunity just to practice, to get a little bit of an experiential taste. And then I'll talk for a few minutes about applications with difficult emotions. So mindfulness is a capacity that we all have. It's part of being a normal human being with consciousness. It's the ability to be aware of what's happening in our experience as it happens moment by moment, what we're hearing and seeing and feeling in our bodies, thinking, our emotions, and so forth. And it's also a capacity that we can refine and develop. And where the emerging science comes in is doing some measures on insomnia or blood pressure or anxiety, having some mindfulness instruction in practice, doing those measures again. And it's quite interesting how much science is being done and how good the results are. So I'm not a scientist myself, but what we do in a meditation, what would be kind of the content of a course like that, is actually relatively simple. And even though we don't have a long time right now, I can explain it quickly and then we'll do the meditation. We do two things, basically. First, we focus our attention on something actually happening in our experience. And we try to keep the attention there. And we choose something relatively neutral, meaning not terribly exciting. And so what you can hear right now, I don't know what's going on around you, but chances are it's not terribly exciting, right? You're not at a rock and roll concert, right? Or maybe you are. There are sensations in our bodies that we can tune into that we are often just overlooking because they don't demand our attention. And so, for instance, the sensations connected with the normal breath, they're there all the time, but we're not paying attention because we don't need to, and we have many other things to pay attention to. It turns out that as human beings, when we take some time just to direct attention to something relatively neutral, our minds become calmer, more clear, more stable, and so forth. We don't have to struggle to make that happen. We make a little effort to do it, and it happens naturally. So that's the first part. I'll guide you in this in a minute when we begin. The second is, even though I've already given a pep talk that we can do this, it's doable, and so forth, nonetheless, our attention will drift away. We'll get pulled away, sometimes rather quickly. And this is not a failure in the meditation. It's simply a sign of our intelligence. As human beings, we are really good at paying attention to what needs to be paid attention to. And we all have lists of things we're supposed to do and problems. And so quite naturally, when I ask myself just to feel the sensations connected with my breath, even when I notice 1 or 2 or 5, some thought will come to mind that pulls my attention away. And so, and then at a certain point later, I'll realize, oh, now I'm daydreaming or planning or worrying and so forth. Perfectly normal. And so in those moments, we include whatever is happening as part of the meditation, meaning just we're aware of it. And in the meditation, we don't have any other responsibility. So it's not that we have to manage what's happening, we just notice. And lo and behold, even noticing things like anxiety can be very healthy, can be very helpful. But noticing the feel of it in our bodies, right? What are not only the stories, what we're worried about, but also what do we feel? Often in the torso, there are sensations. So this can be something we practice, and then we gently shift the attention back to where we were trying to focus. So I would invite you to do a 3-minute, oh, well, let's do 4-minute meditation. So it's a personal activity. You may not want to, but you still can tune in and see what happens if you wish. So eyes can be open or closed. Most of us will find it easier with eyes closed. So if you're comfortable with that, that's good. You might take a few deeper breaths, slightly deeper in breath and out breath. Just one way to begin, just even maybe a little sigh with the out breath. Letting your breath be normal. We'll come back to the breath in just a bit. But for now, notice the sounds you can hear. And notice how easy this is. We don't have to censor any sounds. We don't have to try to hear everything. We don't have to clear our minds in some way. That's a misconception about meditation. Just notice these sounds, some of what you can hear moment after moment. The mind is open, spacious. Sounds can come from anywhere. So you can stay with sounds if you wish. Come back to sounds if you wish. It's also good to practice with our bodies. So when you wish, let your attention settle into your body and notice what can you feel? Head, shoulders, arms, hands, torso, legs, feet. Not looking for anything extraordinary or amazing. On the contrary, just noticing what you actually notice. Vibration, pressure, softness. So we feel into our bodies. It can be natural to notice sensations connected with the normal breath. So not breathing deeply like we began. As the breath happens, there tends to be sensations in the abdomen, the chest, at the nose. So how do you know you're breathing? How do you know the in-breath begins? So sensations somewhere, abdomen, chest, or nose, just let your attention rest there, noticing the feel of the in-breath, the feel of the out-breath. It's no rush. Next breath. Takes effort, a little bit of effort, but it's mostly patience. If for any reason the breath doesn't feel quite right, you can shift to your hands or your feet or back to sounds. It's a personal activity. And then, of course, when you notice your attention has been pulled away and you're daydreaming or planning or worrying, just that gentle recognition, thinking, planning. See if there's emotion, feel it, tune it into it in your body, the feel of it, and come back to the breath. So I'll be silent for a minute and we can practice together. I'll ring a bell simply to end the meditation. So thank you. it's a pleasure to meditate with you. If your response when you heard the bell was, no, wait a minute, I was just getting started. Okay, that's very familiar in my world, right? And that you may have learned something that, oh, okay, yeah, I got a taste of how this can help. It can be hard to believe it can help. And then when we try it, it's like, oh, right. And it is a practice. It can take time. It is very personal. But the idea is that two parts there is that focusing attention on something like the breath or our hands. It can seem so trivial. Why am I spending time doing this? And the answer is, as human beings, there's something about taking the time where that's all we're doing, where we are making effort to be alert. When, what does the breath feel like moment after moment? The mind naturally becomes calmer and more clear. And we can do this in the midst of things happening, even with physical pain or strong emotions. We can do this. We don't have to get everything fixed first. And we certainly don't have to suddenly be able to clear our minds. It's a misconception, as I mentioned. And then secondly, this idea of just tuning into the feel of our emotions. It's just like, we're busy. I'm sure all of you have huge workloads or things to deal with. Everyone does in one way or another. And so very often we're really good at kind of dealing with our emotions by just ignoring them, or by kind of handling, we get angry, but we work with it. We don't do something stupid normally. And there can be a beautiful exploration of, well, what is it like for me to be a human being who feels anger or who feels anxiety? And so this idea of we include whatever happens as part of the meditation is really literally anything, but there's never that obligation to stay with it. So I recognize I'm anxious, I tune into the feel of it, and then gently shift back to the breath. And so both parts are important. So thank you for your attention. I wasn't joking when I said, I was sort of joking, but I love these 10-minute opportunities to teach you everything I know. And it is partly a joke. There's more to say, but this is, from my perspective, the core of how we practice mindfulness and how we can bring it into our lives. So my email is earlier there in the chat. Feel free to contact me or come to the UCLA Mindful Awareness Research Center website for we also have courses and things like that. Thank you very much.
Thank you, Dr. Belzer, for all the mindfulness sessions for our 2022 speaker series.
Thank you.
Okay. All righty. So I'm now pleased to introduce our speaker for this session, Ariel Bustamante. Ariel Bustamante, she, hers, is a former Liberty Hill leader to watch, and American Bar Association panelist with more than a decade of working with social justice nonprofits, including GSA Network, Liberty Hill Foundation, the ACLU of Southern California, and now the RISE program in Children, Youth, and Family Services at the Los Angeles LGBT Center. As a certified HIV testing and prevention counselor, she worked to increase awareness and access to resources in the small town of Pulteney, Vermont during her college years. For more than 6 years, using an intersectional model, she worked to support the leadership development of youth activists and community organizers. As an equity and compliance expert, she has trained thousands of adults in the education sector, service providers, and others across the country at conferences, panels, and through on-site consultation. Thank you, Ariel, for joining us today, and the floor is yours.
Good afternoon, everybody. Hopefully everybody can see my slides and hear me. If I can get like a thumbs up or a nod, it's always helpful. Excellent, thank you. So happy to be with you all this afternoon. Again, my name is Ariel Bustamante. My pronouns are she, her, hers, and if you're a Spanish speaker, ella. And I am, as Brittany mentioned, am the capacity building manager at the Los Angeles LGBT Center. It's wonderful to have an audience from across the country here today. And we have sort of a brief amount of time, so I'm going to try to give you as much helpful information as I can during this time. The first thing I want to do is just tell you a little bit about the center, who we are, what we do. For those who aren't familiar, we are the world's oldest and largest LGBT social service organization. We have 10 locations across Los Angeles County, including an entire transgender wellness center in the neighborhood of Koreatown dedicated to serving transgender, non-binary, and gender non-conforming folks. We have 2 new locations, including one in Boyle Heights and one in South LA. And we continue to grow every single day through the hard work of our over 800 staff and hundreds of volunteers who serve over 50,000 clients every single month in a variety of free and low-cost service areas, everything from healthcare, primary care, specialty care, legal services, including legal services for folks who are seeking asylum or refugee status. We have an amazing cultural arts program that includes a gallery and theater, and so many other rich programs like our youth services department, which houses over 100 young people experiencing homelessness at any given point in time. So to tell you a little bit about RISE, we are a national program, and some of you may have been through some of our sessions before. RISE stands for Recognize, Intervene, Support, and Empower. We recognize that we have LGBTQ+ or lesbian, gay, bisexual, transgender, queer, and questioning young people in the different systems of care that we work in. We intervene when we see instances of bias, harassment, or discrimination coming up in their care. We provide them all the support that they need to be healthy, equal, and complete. And we empower our colleagues, our coworkers, if we're a caregiver, fellow caregivers, to do that same work. RISE started out many years ago out of LA County in partnership with folks like LA County DCFS, which is the nation's largest child welfare system. I like to remind people of that because that is not an accomplishment. That is something that we should be greatly dismayed about, the fact that we have to say that in Los Angeles. But that also means that there's a really great need. And so we initially started as a research project to better understand what interventions actually work to support this population. And part of that work looks like direct services that we still provide today, along with educational opportunities like this. So our educational team, my team, works on a national scale and in some cases international scale to be able to actually provide training, coaching, and technical assistance in English and in Spanish to staff, caregivers, and really anybody who might be coming into contact with LGBTQ+ young people. So we've worked with CASAs from across the country, child welfare agencies, government agencies, foster family agencies, healthcare organizations, libraries, you name it. Again, anywhere LGBTQ+ young people are showing up, we want to make sure that the adults in those environments have the tools that they need to be able to provide a welcoming and affirming and safe environment for them. So I want to just very briefly kind of remind us about who we're talking about. This slide may be in particular very familiar to some of us, and for some of us, this may be the first time we're learning about this term, SOGI. This stands for sexual orientation, gender identity, and gender expression. And I like to start with this framework of SOGI using the genderbread person because it's a helpful piece to understand that all of us have a SOGI, but we probably have never thought about SOGI until we thought about LGBTQ+ people. So the basics of SOGI are this. All of us at some point were born, some of us more recently, some of us a little while longer ago. And when we were born, a doctor, a doula, a midwife, somebody made a declaration based on what our bodies look like. Are we going to stamp male or female on this birth certificate for this baby? And that's sort of the gist of sex assigned at birth as we typically think about it. It's physiological traits, right? The next thing we have is gender identity, who I know myself to be. When I think about who I am, do I know myself to be a man, a woman, or something else? And gender identity is really neat because as a part of typical adolescent and child development, we see gender identity developing around 2.5 to 6 years old, which is when a lot of other really important milestones are happening for little ones as a part of their identity development, cognitive ability, so many other things. So some kids are a little bit earlier, some are a little bit later. And we don't typically expect to hear, a 4 or 5-year-old say something like, my gender identity is this. But we might start to hear little ones in our lives saying things like, I'm a boy and boys do this, or I'm a girl and girls don't do this. Or maybe a little one saying, everyone says I'm a girl, but I'm not a girl. That may be that child starting to better understand their gender identity, starting to understand how all this information in the world around them either resonates and connects with them or doesn't. But again, at its core, gender identity is simply who we know ourselves to be, regardless of anything else. The next thing we have is gender expression. This is how we externally communicate our gender to the world. And there's so many different ways that we can do this through hairstyles, clothing, makeup or no makeup, accessories, behaviors and mannerisms, even careers that we may pursue. Now, the thing about gender expression is it's incredibly fluid, right? So it depends on so many different things like time, meaning what time period are we in, place, what location in the world are we in, and even other factors like our own culture, right? So even of what we may consider maybe more feminine or masculine in the year 2022 in the United States or in particular areas of the United States, that may look very different in another year, again, in another part of the world, or again, depending on our individual subcultures that we belong to. The last thing we have on our genderbread person is our sexual orientation. Sexual orientation is our pattern of attraction, who we're attracted to and who gives us butterflies. Now, because we oftentimes focus in on that prefix of sexual orientation, we oftentimes go immediately to particular behaviors. Who is this person potentially engaging in different behaviors with? But the fact of the matter remains that for many, if not most of us, most of our crushes throughout life, we are lucky if we ever get to talk to them, much less hold their hand, much less go on a date with them, but we still know how we feel about that person. So even though we sometimes get stuck on conflating sexual behavior and sexual orientation, those two things may or may not be directly aligned. Again, it's our pattern of attraction. We start to see this developing around 6 to 12 years old. And again, you may not hear a child say something like, my sexual orientation is, but maybe there's a school dance coming up and there's a special someone they want to take with them or a special Valentine that they want to make. And that may start to give us indicators about who that child or young person is finding themselves attracted to. Now that we have that kind of context and again, primer to kind of go into this, I want to talk a little bit more about the experiences of LGBTQ plus young people, particularly because we have this wonderful national audience and there's so many different things happening on this landscape. We know that at least 40% of young people experiencing homelessness self-identify as LGBTQ plus. Now, I really want to emphasize the self-identification piece because we know there's a flaw in data collection. We know that this is underreported and that vulnerable communities oftentimes do not feel safe or comfortable to disclose these things. So at least 40% of young people who are experiencing homelessness self-identify as being a part of this community. The next thing that we look at is juvenile justice or detention involved young people. And at least 20% of those young people are a part of this community. Now, when we start to look at child welfare, we have some different figures to look at. We have a few different figures based on our RISE study with DCFS in 2014, and also the UCLA Williams Institute, which is at 19% or 1 in 5. There was a national study done that said around 23%. And then the actual most recent study out of pediatrics indicates that about 1 in 3 young people in child welfare self-identify as LGBTQ+. This is really important to look at these statistics, and this last one is around school-based bullying or harassment based on their identity, because we're seeing a convergence happening, right? We're seeing young people are showing up in these systems where they often experience additional harm and rejection and a lack of permanency. We know that there's a relationship between things like homelessness, ending up in juvenile justice settings and or foster care, right? Disruptions in school leading to some of these things. And so we have to really understand and accept that these young people are here and they need our help in so many different domains of their life. With that in mind, I keep using this word permanency. And this is where I really want sort of the wheels to get turning for you all as you start to think about how this work or how this topic relates to the work that you do. Depending on who you talk to, permanency may have a very different definition, right? Depending on your role. If you're a caregiver versus an attorney for a child in foster care versus a probation officer, right? Or a mental health clinician, you may each give me a different definition of permanency based on your role. At RISE, we really like to think about permanency as holistically as possible. We really know that it's not just about the physical, but it's about legal, social, mental, emotional, all of those pieces combined to create a safe, stable, and well environment for young people. So this really just says that, again, probably what we all know as adults now, life isn't just about surviving, it's about thriving. And are we making sure that young people in these different systems have access to things like supportive adults, healthy connections, and the resources that they need to hopefully exit care with those things like safety, well-being, and permanency. With that in mind, let's talk a little bit about some of the ways that we see permanency being sort of disrupted or barriers. These can happen at a lot of different levels. There's 3 different words that I want to introduce you to here, all of which can take place at an institutional or individual level. The first one, anti-gay bias, describes hatred, aversion, or discrimination towards folks who are part of the LGBT community, and specifically lesbian, gay, bisexual folks, people who are perceived to be, or people who are associated with LGBT folks. This can happen on a lot of different levels. One way that we see this happening very regularly is caregivers, licensed caregivers saying, I can't accept one of these children into my home. And they express perhaps a concern about how this young person may behave or influence other children in the home. That would be an example of anti-gay bias. This next term, anti-transgender bias, is very similar. Hatred, aversion, discrimination towards folks who are transgender, gender nonconforming, or non-binary, aversion to, or again, folks who are affiliated or associated with folks who are trans, non-binary, and gender nonconforming. One of the ways that we see this happening is we see a lot of regulation around how children and young people express their gender identity and express their gender, right? So not allowing young people to wear the clothing that they choose to wear, not allowing them to take part in the activities that they want to take part in, or in some more extreme cases, even limiting their access to life-saving medical treatment. Last but not least is this idea of heterosexism, the belief that everyone is or should be heterosexual. Now, this one is a little bit tough because a lot of people say, well, again, it's 2022, of course I don't think that. The fact of the matter remains is that all of our programs and services, or typically our programs and services, operate from this particular framework, right? We know that if I go to refer a client to another service provider or agency or organization, I don't have to screen them to figure out, are they a safe agency for a straight child or for a child who is not transgender, AKA cisgender, right? I don't have to do that work. I never have to do that work. That is part of heterosexism, right? This idea that inherently the world and the spaces we've created are always going to be safe for straight and cisgender young people, but that we have to do extra work to make sure that home environments, caregiver environments, school, etc., are all safe and affirming places for LGBTQ+ youth. As I mentioned, this can take place on the individual level. So people to people, individual actors, staff, officers of the court, healthcare professionals, caregivers, right? The list goes on, anybody who's coming into contact with these young people. It can also happen on an institutional basis. Sometimes it's policies that are explicit, sometimes it's the lack of policies. Sometimes it's an example of us as an agency saying, hey, we want to come and provide you staff development or provide a training or an opportunity to talk to caregivers and give them information. And an agency saying, we don't serve that population here, or that's not an issue that we need to address, or we've had adequate training, we're good, thank you. And we know that that's just not the case, right? LGBTQ+ people are everywhere in every state, in every country. We know that there's intersections, particularly when we start to look at Black and Brown young people who are part of the LGBTQ+ community, right? There's so many ways that we can address this issue that are not being addressed thoroughly. So again, going back to this framework of permanency as a holistic thing, depending on your particular role, we can be thinking about all the different domains and the cycles in which young people kind of go in and out of different areas where they may be experiencing harassment, bias, discrimination, or other unnecessary hardship simply because that system is not prepared to support their needs, right? And not prepared to actually, again, do things that we know based on research is actually life-saving. Things like referring to a young person using the correct name and pronouns, or providing them life-saving medical treatment. Things like making sure that caregivers have proper training and education and access to resources to be able to provide a safe environment for their child. And the list goes on. So let's talk in particular about caregivers. This particular research here that I'm sharing with you comes from the Family Acceptance Project, which many of you may be familiar with. They're out of San Francisco State University and led by Dr. Caitlin Ryan. And what this research project aims to look at is what is the effect of accepting and rejecting behaviors on LGBTQ plus young people. And what they found when comparing those two things with the same sort of population of young people is that young people who experience extreme forms of rejection, so name calling, bullying and harassment, and name calling can even be things like not, again, calling them by the correct name or pronouns, in addition to some of these more ugly, colorful terms we may know. Not providing affection and things like that. LGBTQ plus young people who experience these things were 8 times as likely to attempt suicide. This is big, right? We're not even talking about suicidality and having suicidal ideation. We are talking about an actual attempt, which also then equates to potentially higher needs and needing a higher level of care. They are 6 times as likely to report clinically high levels of depression, 3 times as likely to be at high risk for contracting sexually transmitted infections and diseases like HIV, and 3 times as likely to use illegal substances. A lot of this happens not because caregivers are malicious or that they don't care about the young person in their life, but they don't have the right information, right? They have misinformation. There's a lack of resources, even in places like Los Angeles or San Francisco or New York City that have these great hubs and rich resource areas like the LGBT Center, right? Many people don't know or feel comfortable accessing those resources. Maybe they're not offered in a language that's accessible to them or at a time that's accessible to them, right? And also many caregivers simply just don't understand the unique developmental needs and milestones that LGBTQ plus young people experience, right? In that book, What to Expect When You're Expecting, at least the last time I checked, maybe it's been updated, there isn't a chapter on, your baby might be LGBTQ plus. And what does that mean? And how do I support them a couple years from now, 5 years, 10 years, 20 years down the line, right? So I want to kind of normalize and name that, many of our caregivers are doing the best with what they have, and it is still our obligation to ensure that young people have a safe and affirming environment, right? And so if a placement, whether it's with a bio family or with a foster family, is not safe, we need to make sure that young person is safe and prioritize their needs above that caregiver, and then on the side be providing that caregiver the support that they need. Other things that we know sort of exist within this landscape is just sort of the way that the child welfare system is designed and set up. As I mentioned, any of the number of professionals that come into contact with a young person in care, social workers, attorneys, judges and bench officers, caregivers, all of those are places where a young person may experience bias and may continue to hear that message that something about them is wrong or bad or not okay. The research on the side here is from that RISE research project. And what we found at the time, and these numbers have probably changed, maybe even gone up, is that LGBTQ plus young people were 2 times as likely to report poor treatment by the foster care system as compared to their straight and cisgender counterparts. And they were also 2 times as likely to live in a group facility rather than in a loving family home environment. In California and in many other jurisdictions, we know that there is this increased movement to address this issue of congregate care. We know that young people do not thrive in congregate care facilities and that the ideal space for somebody to grow up is a family-like environment. And yet, disproportionately, this population is showing up in group facilities where, again, their needs are just not being met. They oftentimes languish and they exit care without permanency. Another sort of challenge we see here within the child welfare system is just general confidentiality and young people being outed, sometimes intentionally, sometimes inadvertently, when trying to get them the care that they need. So in some jurisdictions, there are actually laws and policies in place that really codify information about somebody's SOGI, sexual orientation, gender identity, and gender expression is private and confidential, and specifically that it is on a need-to-know basis. So perhaps if that child has consented, and they say, yes, it's okay to tell this new caregiver that you're placing me with, or yes, it's okay to tell my clinician, then we are able to do that. In other jurisdictions, there is absolutely no law or policy in place. And in some, it's considered actually information that needs to be shared. So that is a problem because that inherently creates risk for young people if we are outing them without their permission. Again, as I mentioned, there's sort of this lack of legal framework and or implementation. For any of my policy sort of wonks in the room, we know, right, that a policy is only as good as the people who know about it and use it. So it's great if your agency or your jurisdiction has wonderful laws and policies on the books, but if nobody's actually enforcing them, then all they're doing is collecting dust, and young people are going to continue to experience harm. As I mentioned as well, disaffirming and unsafe placements. And fortunately, I still see this hesitation around having maybe some difficult conversations with caregivers, and really, again, affirming that you have chosen to be a caregiver in the foster care system. Young people did not choose to be in foster care. And we have a legal and ethical obligation to protect those young people above caregivers, right? Whether bio or placement. There's also a lot of institutional obstacles. This isn't all of them, but some of the ones that I wanted to really highlight in our discussion today was first, commercial sexual exploitation. Again, as in other sort of negative experiences, risks, and outcomes, we see LGBTQ plus young people overrepresented in young people who are being commercially sexually exploited. But unfortunately, our framework across the country really doesn't address the needs of this population. We are typically focused on cisgender girls. And so in doing so, there's not a lot of shelters, there's not a lot of knowledge around serving this diverse population. Mandated reporting laws, you know, they are there for a reason and they are important. They also could create complications when sometimes we, again, have to disclose information or report things and bring sort of local government into somebody's life. Protection orders, when we start to think about things like intimate partner violence, we know that teenagers, actually 1 in 3 will experience some type of intimate partner violence. That number again goes up for this population. But when it comes to systems like child welfare, we oftentimes aren't prepared to deal with, okay, my child is experiencing abuse and neglect at home, and now they're sharing with me that they are in an unsafe relationship with a romantic partner, right? Things like protection orders are typically unattainable for minors, or if they are, it can be very difficult to get that. And then when we think about laws and policies pertaining to unaccompanied minors, delinquency, and custodial rights laws, that also can create some complications in young people accessing service providers, be that a homeless service provider, child welfare, or just other sort of providers, right? So mandated laws around age of consent, which vary state by state or jurisdiction by jurisdiction, can create lots of different complications for young people accessing the services and care that they need in a confidential and safe way. Healthcare sort of is a perfect segue from that. And we are obviously in a very big moment right now where we're starting to re-engage in this conversation about access to healthcare. First and foremost, having a knowledgeable provider is so critical, even if it's just for primary care, right? Making sure that your primary care provider is knowledgeable about LGBTQ plus identities and experiences. And that can be really hard to find. Again, even in places like Los Angeles, we are lucky to have access to a number of great resources. Some of these have been institutionalized. For example, Los Angeles County DCFS has an entire clinic dedicated to the needs of transgender young people. We partner with our local children's hospital as well to provide gender affirming care. But those are just 2 hubs in the heart of Los Angeles. And many young people who are further out in Los Angeles, again, in other jurisdictions, don't have that same access. As I mentioned, gender affirming care is life-saving. We know, and there's plenty of research around the impacts of gender affirming care, and making sure that young people have proper access to things like hormone replacement therapy, hormone blockers, and even social transition tools like name and gender marker changes. And unfortunately, there still remains a stigma, whether or not we want to admit it, around things like HIV and AIDS and STI status. In particular, if anybody is in doubt, just look at some of the rhetoric and stereotyping that is happening around this current sort of monkeypox epidemic that has come up. and understanding that this is a disease that's affecting a lot of people, but like many other diseases and conditions, it has sort of been labeled as an LGBT condition, even though that's not medically accurate. The other piece to be thinking about is, again, just some general laws and policies. This particular map is from the Movement Advancement Project. And I am remiss to say that each time I look at this map, it looks different. My hope in going back to this map on a regular basis is that I would see more of this kind of dark green color, meaning that there's more jurisdictions where LGBTQ plus young people in the child welfare system have access to protection. Unfortunately, what we're seeing is that we're going the opposite direction. More and more, we're seeing laws and policies put into place that actually remove those protections that young people have, that remove the protections that caregivers have, and that actually criminalize or penalize things like access, again, to healthcare, access to affirming placements, and all of the other needs that we know young people have. So I'll leave this here for a second in case people kind of want to take this in. But again, you can go to Movement Advancement Project's website, and they actually have a variety of maps just like this that are interactive, depending on whatever issue area you're interested in learning more about. And it will give you this map to kind of show you what the state of the union is, depending on that issue. So again, we see here 29 states and the District of Columbia currently have statutes, regulations, or policies prohibiting discrimination in foster care based on SOGI. That's, and only 6 states and 1 territory have anything that prohibit discrimination based specifically on sexual orientation, so not the broader spectrum. Only 15 states and 4 territories, or rather 15 states and 4 territories have no explicit protection, right? So it's just sort of up in the air. And 12 states actually permit state licensed child welfare agencies to refuse to place and provide services to children and families, including LGBTQ people and same-sex couples. So this is, again, a growing issue, as we know. So from here, I want to talk about, well, what can we do about this? What are some tangible tools? Because again, a lot of this information is probably not new to any of you, at least in theory, right? But it can be helpful to actually have some tangible tools that we can put into place. This is again from that Family Acceptance Project research. And what it also looks like, as I mentioned, are what are the accepting behaviors that a caregiver, that a provider can demonstrate to have a better impact on LGBTQ plus young people's lives. We actually have the ability to save young people's lives, right? Requiring respect, advocating, using those names and pronouns. Those are all life-saving measures. Those are all harm reduction measures. And I am not being hyperbolic when I say that it is so hard in this work, right? We oftentimes do not see the fruits of our labor. And providing safe and affirming environments for young people is absolutely life-saving work. We may be the only person in that young person's life who affirms their name, who affirms their pronouns, who makes sure that when a caregiver uses a slur towards a lesbian, gay, or bisexual young person, that that is addressed, right? So when we do things like require basic levels of respect from our caregivers and from our provider community, or we advocate for them in instances of trouble and challenges, when we give them support, when we are a listening ear, when we can express affection in a professionally appropriate manner, right? All of these things are shown to have an effect, a positive effect on young people, LGBTQ plus young people, including higher self-esteem, closer relationships with family, which is again, right, why many of us are here. We do this work in child welfare for that. Believing that they can be a happy, healthy adult, and again, better overall physical health. So this is big and important stuff. I can't emphasize that enough. This is very important stuff. And it's basic, right? It really is not asking that much to say that we do these very simple things and behaviors to make sure that LGBTQ plus young people know that there is a world that loves and affirms who they are. Some of those other basic tools that I want to again give you to sort of think about, well, how can I incorporate this in my day-to-day work, regardless of my role? When I'm doing introductions, I can make sure that I use, someone's just going to mute that. I can make sure that I ask for, and I also introduce myself with pronouns. I can ask that young person how they want to be identified. Are there multiple names? Who knows these names? Is it okay for me to document this in my case notes or other areas, right? Are there people who I need to be mindful of sharing this information with? We can use those basic rapport building skills, getting a chance to know what their hobbies are, their interests are. Do they have access to mentorship and support groups that, again, not only attend to their needs as an adolescent, but also specifically as a queer or trans young person? We also can take the time to learn their stories and normalize their experiences. Many young people are used to either having their entire identity become sort of what their case is about. We learn that they're LGBTQ+, and that's the only thing we basically can hear at that point, or we completely disregard that. And being able to take in their experience, learn their story, and give them client voice and choice is really critical. We can also use environmental cues. Environmental cues are the things that we do without ever saying anything that let our community know what our values and our culture is about. So maybe I have pronouns in my email signature. Maybe I have diverse books and posters in my office space where families come to do visitation, right? There's lots of different ways that I can communicate to a young person, to their caregivers, and to my colleagues what our agency is or isn't about. And then there's also additional language tools that we can be thinking about. When a young person comes out to us or shares information about their experience, we can take a look at some of these phrases as opportunities to, again, build connection. That's really what our work is about, right? Building connection and allowing that young person to feel safe and trustworthy of us. So we can make sure that when a young person shares information with us, we affirm that this was brave and this was courageous and this was important information that they shared with us. We can honor their right to privacy and let them know, is this something that you've shared with other people? If not, how would you like me to proceed with this information, right? Is it okay to talk to other staff about this, maybe to help get you resources? And again, in that case, we want to be clear, why am I sharing this information? I'm not just sharing this information just because, just for chatter or gossip. I'm sharing it for a purpose. I'm going to my colleagues, maybe at another agency, and saying, hey, CASA, I have this young person. I see that they don't currently have a CASA, but might benefit from one. Can we specifically look at finding a CASA who is knowledgeable and affirming of LGBTQ+ young people? Or, hey, local LGBT center, this young person is really interested in going to one of your groups that you have, right? So using that information in a mindful and thoughtful way. This piece I thought was particularly timely, and I really wanted to elevate this as we think about access to healthcare, because it's important to understand that reproductive health and reproductive justice is absolutely an issue that affects the LGBTQ+ community. And again, when we start to look at things like access to care, this is another area where we see a disproportionate effect on LGBTQ+ people, especially LGBTQ+ people of color. So as we're having conversations, as many of us already do, and many of us have to and should be having around things like healthy relationships, bodies changing, right? All these things, healthcare decisions with young people, we can also be mindful of how we are maybe unnecessarily gendering our language and how we can open that up to be more inclusive. So rather than specifically talking about breastfeeding, we can talk about nursing, pumping, or some people like the term chest feeding. If we're talking about somebody and their experience, right? People who menstruate, somebody who's pregnant, rather than an emphasis on sort of the female body or women, because we're now excluding folks who are transgender, non-binary, intersex, and it's just, again, not medically accurate. When we're talking about trans, non-binary, and gender non-conforming people, we can make sure that we talk about, and again, if this is relevant, maybe I'm letting my coworker know this client was assigned female at birth, their gender identity is woman, right? And rather than saying, well, so-and-so, this client, this young person was born a girl, but they're actually a guy now, right? Language like that invalidates that person's identity and experience. If we're talking about things like safer sex, right? We can be talking about things like an insertable condom versus a male or female condom. And again, that's more accurate to talk about these things in that way. And then in phrases like maternity, paternity, etc., we can talk about parenthood, pregnancy, an expectant parent, right? All of these are language that still get to the same point, but are not excluding people of different genders. Lastly, we can think about how we are institutionalizing allyship. So what are the ways that 365 days a year, our agency, our community, right, our local legislature is really thinking about how we are making these things sort of the standard of practice and in line with best practices. Allyship is really important to think about as a verb. It's something that we do, and we have to do it on a regular basis, even if we're part of the community. And it's not something that we get to simply claim for ourselves, you know, put it, if we're on social media, maybe on our Instagram bio, or, you know, feel good about it and then not do anything with it. It really takes work. So we want to make sure that our agencies are welcoming of caregivers and families of any configuration, and that that's explicit. Again, making sure that families are able to see themselves represented in things like the staff and the services that are provided, etc. We can display environmental cues, as I mentioned. Posters are a great way to do that. I know many of us are still kind of remote or doing this telework environment. So a Zoom background is a great way, again, to let somebody know what you are or aren't about. We want to make sure that policies are aligned with best practice so that youth can go by their chosen or affirmed names and pronouns. And I shouldn't say a word, but in spaces, in provider spaces, right? So at least in the state of California, for example, there's only a few places where legally a client has to have their legal name and gender marker reflected. That's a very particular part of their case file that may be on other legal documents, right? But in practice, in day-to-day working with that client, there's no reason why I can't use a nickname or, again, an affirmed name that they go by. We want to make sure that our spaces are gender inclusive. So when a client comes in to access services, or if we are going to go on an outing, is it going to be a safe and affirming place for them? We can also make sure, as I mentioned earlier, that we are writing, sharing, and enforcing, this is the big part, formal policies that bar discrimination in care based holistically on SOGI. We can continue sort of an attitude of a growth mindset and learning by regularly asking for pronouns, for example, and sharing our own and asking, not assuming, never requiring though folks to do that. And again, continuing the learning right in general. We can also support local initiatives that improve outcomes, positive outcomes for LGBTQ+ youth. So there may be work being done in your local area that is really elevating these needs and doing something about it. And then, as I mentioned, training, coaching, technical assistance, continuing to develop and learn about LGBTQ+ youth experience, especially when we can learn directly from them. That is a really critical piece. This is just, again, one brief sort of session for us to talk about some of these really higher level pieces, but there's so much more that we can continuously learn about and ways that we can support, again, staff, our fellow caregivers and volunteers and people generally in the community to better support young people. So my sort of action or call to action for you all is to be thinking about what is one area relating to LGBTQ+ youth in systems of care that you would like to focus your work on at an agency level, at a local, or maybe even state level. Feel free to drop some ideas in the chat. And again, think about this whole idea that we talked about of permanency. Are you somebody who wants to maybe look at the school-based environment? In which case, reach out. We have a national schools program, Out for Safe Schools, that we can provide some support to you. Do you want to focus on things like access to mental and physical health care? Do you want to make sure that your agency has a policy in place? And do you need help writing one of those policies? Those are all, again, places where we might be thinking about how can we address this. So we don't have to start on this giant level. I know sometimes change can seem really unattainable and difficult because we're thinking, oh my gosh, I have to do this major thing in order for change to happen. But even something as simple as saying, you know what, we're going to do an in-service training for all of our caregivers, or we're going to make sure that we let young people know that our agency is celebrating Pride Month and that it's important year round that we support their needs, right? Small steps like that can absolutely impact bigger change. With that, I sort of want to leave you all with a best practice guideline, because this work is, again, there's not a lot of concrete and hard rules that we follow, because we're working with individuals who each have a unique story. So at the end of the day, rather than focusing on, do I need to memorize a bunch of terms? Do I need to constantly carry that gender-read person around with me? No, instead what you can do is, again, understand that the individual is the expert on the content of their personal culture and identity. So we really want to look to them to help define what health and healing and wellness and safety look like for them, not necessarily on what our own sort of assumptions or framework may look like. So I'll leave this slide up for a second while I also put in the chat. I'm going to put in a few different things for you all. First of all, if any of you are in the Los Angeles or Southern California area, we are actually hosting an open house event on site. It's going to be great. There's going to be catering and resources, and this is tomorrow, so I know very short notice, but if any of you are available, we would love to have you joining us. The next thing that I am going to share with you all is a list of books for LGBTQ plus young people. So this particular list is great, again, regardless of your role, caregiver, provider, you name it. This book list, if you're ever looking for, hey, what are some books that I can share with a young person to maybe help engage in this conversation, this is just a short list of those. The next one that I'm going to share with you is a pronoun document. It's just kind of a primer, a 101 on pronouns in case you're ever stuck. We didn't go too in depth on those today, and so you can just take a look at that. The next thing I'm sharing with you, lots of good stuff, and again, if anybody needs them, again, just send me an email, is the genderbread person, including a coloring page. And the last thing I'm going to share with you all is a glossary of terms, with that caveat that, you know, definitions change from time to time. I would encourage you not to obsess over memorizing these terms. You can take a look. It may be helpful to explain some things. At the end of the day, though, if you're not sure what a term means, you can always just say to somebody, thanks so much for sharing that with me. Can you tell me a little bit more about what that word means to you? So I'm going to stop sharing my screen now. I will put my contact information in the chat once again. And I think we'll open it up to sort of Q&A and any sort of comments folks have. So I'll turn it back over, I think, to you, Brittany.
Yeah, thank you so much, Ariel. That was super helpful and like really informative. I don't know if there were any questions logged in the chat. I was kind of watching it. Everyone's kind of just taking it in. But if anyone has any questions, go ahead and throw them in the chat now. But yeah, we'll wait and see for a bit.
And I will just say, there are no bad, stupid, whatever questions. I really welcome any and all questions that are, you know, with good intent. So please feel free to ask any questions that you may have about how to kind of practice some of this stuff or how to access resources. Tracy, feel free to send me an email and I can connect you with some of the programs in San Diego, including the San Diego LGBT Center and the North County LGBT Resource Center. Okay, so there's a question from Daniel. Do we know of any programs that work with systems impacted people to travel and learn about culture? I don't see you in my very big list of people, Daniel. Do you mind going off mute and expanding a little bit on what you're looking for?
Yeah, I'm sorry. I jumped in like super late. I'm actually on rotation. We're traveling to like Puerto Rico right now to do social justice work. But My question is geared towards like traveling and learning about culture, obviously, because for one, a lot of people that are system impacted, specifically, former foster youth and probation and LGBTQ like communities, we don't really know too much about our culture. So, one of the ideas that I came up recently is basically I want to start, developing a program where I could travel and teach creative writing to third world countries and also just learn about, where I come from and where other people come from too. But I think, there's programs out there, and I was just wondering if you guys knew of any that already existed that are doing similar work to that.
Thank you for expanding on that, Daniel. That's a really great question and idea. And unfortunately, I'm not aware of any particular program like that, at least not one that works with LGBTQ plus young people. I'm not sure if anybody else in the chat or wants to unmute and chime in, but I'm not currently aware of that. Vanessa asked, is it best to ask directly how someone wants to be referenced in terms of identity? How would you suggest phrasing? Great question. So it kind of depends on your role, I will say. For example, if I am doing an intake with a young person, I'm meeting them for the first time, I need to fill out some paperwork, I might just kind of go down that list. Again, that's another place where you can institutionalize, make sure that your paperwork and your documentation systems have SOGI included. And what I would do is let that person know, I'm going to ask you a lot of different questions about who you are and your experience. And some of these questions may be hard or confusing. You at any point can take a break. You don't have to answer all of them. So I want to normalize those things in general, right? All those questions for all young people. I always want them to know, I'm not going to force you to tell your story right in this second or force you to, share a demographic or anything else like that. And from there, I might say, okay, so a couple of questions I have for you. How would you identify your sexual orientation? You could potentially provide them a list, right? How would you identify your gender identity? I have found, and what our providers here at the center have found, is at least for older youth, like teenagers and above, it can be really helpful to allow them to fill out a form independently and then circle back with them to review it, because oftentimes they feel a little bit safer and more comfortable to kind of go through that and check off, what that identity may be, instead of having that immediately in a conversational format. And we also want to let young people know, right? I ask this of everybody. I'm asking this information because it's going to help me provide better care to you. Because sometimes young people may wonder, well, why are you asking this of me? Are you making assumptions? Is this a safe thing to tell you? So that can be really helpful. In terms of name and pronouns, it's very sort of simple in the way that we can do that. We can model that in our introductions. Hi, my name is Ariel. I'm going to be your new social worker. I go by she and her. How do you like to be referred to? Oh, okay. I see, Philip is on your paperwork, but you go by the name Phil. That's great to know. Is that okay for me to share with the other people who are working with you? And then, we can go from there. Same thing with pronouns. So hopefully that's helpful. Let's see, I think the next question is from Desi. Where do we find resources for trainings and support for caregivers and foster parents? And I think Brittany put my email address in there again. You can go to our website. Like I said, we do provide training, coaching, and technical assistance to agencies and to caregivers and providers. We can do that in person or virtually. So just send me an email and we can talk about details. Philip raised a question, Philip Liu from LA County DCFS. You raised up a good point in the training about not just having policy and legislation in place, but also making sure that institutions and service providers are following through and implementing them. In LA Child Welfare, we have policy and legislation in place for our LGBTQ plus youth and families. We are engaging with other staff, but how do we get upper management and leaders in institutions to push more and follow through that staff are expressing those policies and legislation? I love this question, Philip, because again, this really gets to the bigger picture. Again, it's great when we have smaller groups of staff who are really engaged in uplifting these needs and addressing those needs. And if we don't have management, if our agency as a whole is not practicing this consistently, then we are having a huge missed opportunity. I think, one of the things that we can be thinking about is in particular things like hiring decisions. You know, LA County recently went through a process of bringing on a new director of their child welfare system, right? That's a really critical role. And so when we're making these important hiring decisions, are we making sure that the people that we're bringing into our agency reflect the values and culture of that agency? And that can be something that we can be looking for as far as talent and candidates that we're bringing on. We can also be thinking about making sure that when it comes to things like coaching and ongoing learning, that that's not just something that line staff go through, but that all staff go through. Even if you're somebody in accounting, there's a way that this information can be applicable, and again, help emphasize that this is what the values of this organization are about. So sometimes I see this disconnect where upper management, middle management, even sometimes leadership is disconnected from that day-to-day sort of operational piece. And I think that's important for them to really understand the impacts of this work and how to apply it. So those are just some initial ideas that I have about that. I think building off of that, how do you raise their commitment level, make them do more? You know, I think there's a couple of different things that you can do. You can do things like show them the financial impact. That oftentimes, right, unfortunately, data speaks volumes. We can talk about lived experience, and that's really important too, having real people share their experience, and couple that with things like having really good data. And I know that that's something in LA County that you're working on. But also looking at the financial impact. If we actually break down the financial impact of young people coming into care and staying in care, in particular like STRTPs, group homes, et cetera, versus the financial impact, if we reduce that burden, that number, I don't have it off the top of my head, right? But that number I'm sure would be astounding if we started to compare that. If we started to compare the cost of institutionalizing young people in mental health facilities, right, versus getting them the adequate care that they needed, I think that a lot of people would listen because they would start to see, even if this is a topic that I feel particularly knowledgeable or passionate about, if nothing else, as a system leader, I can see that this system is being overburdened and we have the ability to impact that. Obviously, you know, it's great to also have a more ethos approach. And if people can come in from a place of compassion and wanting to do this work, that's great. But sometimes it takes people coming in at a different level before they can really feel the emotional impact of this work, right? And the ethical pieces and the goal, right? Why are any of us doing this work? Why are any of us dedicating, you know, a couple hours of our afternoon to hear me talk? Mary said, are these going to be added to the Pritzker resource page? That I do not know, but I'm sure we can work with Pritzker to add some resources around LGBTQ plus young people. We've partnered with them in many instances. And so, you know, stay tuned. It looks like Brittany said yes. Resources. Philip, yes. You asked for the research study, and I will get that link for you in just a minute. Are there any other questions?
I don't have any question. I just want to say I went to the website, and if you scroll all the way to the bottom, then you can sign up for the newsletter. And that has a lot of information, like up-to-date events and things. So we are like referring our clients and coworkers and trying to participate ourselves, possibly like volunteer. So just sign up for the newsletter.
Oh, that's a great question. Emily asked, does the center provide resources for affirming care for transgender clients? We do. We have really robust programming for all stages of gender affirming care and transition, everything from social support groups to connect with peers and mentors, legal support for folks who want to change their name and or gender marker in the state of California, along with access to medical care, including hormone replacement therapy and access to surgeons in the area. If you are outside of the Los Angeles area, but you want to get connected to your local LGBT resource center, or you don't know where your local LGBT resource center is, just send me an email and I can do sort of a warm handoff to your local agency, and make sure that you have sort of a point of contact there. Tia asked a great question. How do you get more people on board with actively supporting policy? Are there any good training resources focused on how to have conversations about SOGI? Yes to the second part. Tia, I can follow up with you one-on-one. I'm drawing a blank as far as links to give you, but yes. And I think it also, again, depends on more context as far as who or what you're hoping to have those conversations about. And again, I think about getting sort of that buy-in around policy changes, around implementation. I also think that being a squeaky wheel, having outside support is also really critical in any advocacy campaign. So not only having the inside support, having staff and other internal stakeholders who are pushing this, but when you have an external driver, when you have community members who are really speaking up and saying this is important to us, and again, like I said, having that kind of squeaky wheel approach, that can oftentimes be influential, right? So making sure that there is sort of inside and outside pressure happening so that there isn't this argument, well, only these people who are disconnected out here are asking for this and they don't know what's happening, or only the staff here who are otherwise disgruntled about other things are asking for it. Instead, we can say, actually, there's clearly a demonstrated need that we can show you in the data, right? We can show you the financial impact. We can share client stories. And we can also show that there is a will to have this work be done, right? There is a drive. And again, going back to, like I said, ethics, goals, right? Why do we do this work? If we are in any way connected to the child welfare system, to mental health, to homeless services, if we are a parent or a caregiver, we know and love and care about young people in our lives. And that should absolutely mean that we are doing anything and everything in our power to make sure that they grow up to be happy, healthy young adults. Alan asked a question, is the center starting their coaching network again? Yes, stay tuned, Alan. Starting in the fall, we will be resuming potentially in person, but most likely a virtual coaching network. And so that'll be an opportunity for folks, not just here in LA County, but across the state and across the country to connect with us on a monthly basis, and be able to kind of continue learning and connecting with other folks in this field.
And Ariel just got a question about slides. Would you be okay with sharing slides after the presentation? And I can send it out to folks.
Absolutely. Yes, I will send a PDF of the slides.
Okay. Yeah. Thank you. Yeah, so if people don't have any questions, we can also wrap up a little early too. Thank you all for your questions, and thank you, Ariel, for answering them and speaking with us today. Just like a few closing remarks for folks on the call. We have the link, Arushi just put it in the chat to the certificate for those in attendance. Just put your email and you should be good and sent that soon. And yeah, so please follow us on our social media account and visit our website. And you're welcome to contact us with any questions in the future about future sessions past. Yeah, and this concludes our 2022 Community Speaker Series. And thank you all so much for participating in it. So this concludes our 6-part series. So stay tuned for future trainings from the UCLA Pittsburgh Center. Like I said, our social media and website will have more information.